Welcome everyone to this webinar on the Health Horizon Calls 2019. The aim of the next 45 minutes is to give you an overview of the just launched Health Horizon Calls. The Societal Challenge Health Demographic Change and Wellbeing launched a call at the end of July with many different topics for which proposals can be submitted. But first of all, who are we and why are we doing this? Euresearch is the Swiss guide to European research and innovation. And in this role, we are funded by the State Secretariat for Education, Research and Innovation, called SERI in short, to provide targeted information, hands-on advice and transnational partnering related to European research and innovation programs. All our services are free of charge, and we are here to support you in any step trying to find and to apply for funding in this European Research and Innovation funding program called Horizon. Who is we? We are a network in Switzerland with over 60 people working at different offices. First of all, you have 10 regional offices. They are at every university or University of Applied Science and are located in their regions for the entire region. In addition, we have the network office. To that in a minute, because that's where the national contact points are. And then we have the Swiss core office, that's the office in Brussels, that always are up to date on the latest development and information on these programs. The regional offices are your first port of contact. They can answer you any questions regarding the different programs, the different calls, deadlines, and assist you in setting up a budget and all the other many different information that you need in order to submit all the forms that go together with an application. Now, the network office. The network office hosts the so-called national contact points. We are nominated by the Swiss government, and the national contact points exist in every European country or an associated country like Switzerland. We are mandated to provide specialized advice on research funding opportunities in a specific program in Horizon. Now for today and the national contact point, one of the two for the health program. For every program in Horizon, there is 1 to 2 national contact points per country. We are here to ensure that the program is readily accessible to all potential applicants in our country. And we participate regularly at trainings and workshops organized by the European Commission in Brussels or elsewhere for us NCPs. So we meet all the different national contact points from the different countries. We exchange best practices. We distribute partner searches if you need an expertise that you are still lacking in a consortium, and we work closely together and collaborate. We also organize partnering events for the European Commission after or in connection with launch call info days. The next partnering event that we are organizing is in Oslo in September for this call, and another one later on. More to that later in this presentation. Our specific national contact point services in Switzerland are applicant trainings. That's really trainings, one-day trainings for people that are writing proposals to a specific topic of a specific call. The next applicant training will be on the 23rd of August, and any one of you preparing a proposal, I warmly welcome to participate. The topic preview is a document that summarizes the launched call that you can very quickly, without losing too much time, see whether you and your research field and research expertise fits into an open topic. The proposal on consortium advice consists of giving you advice which expertise you may still be missing or you may need to submit a successful proposal to an open topic. And we read your proposal and give feedback if you wish us to do so. You contact us at health@euresearch.ch. The entire Euresearch network has many other services. In broad, you can put them into 4 categories. We organize events, most of them free of charge, except if we invite an external speaker. These events inform you on specific programs, on specific aspects of proposal writing. We inform you on calls, on funding opportunities, on partner searches. We advise you in the proposal. We can give you tailor-made advice to your project idea or proposal. And we can connect you with other partners in Europe. This horizon is it's the biggest global funding for research and innovation in all research fields. You can see here many different programs. This is the three pillars that summarize all the different programs on the horizon. On the left, you see excellent science. Middle, you see industrial leadership. And on the right, the societal challenges, where this so-called health work program, the health calls are, that this webinar is about. But in case after this webinar you are realizing that there is no open topic in this year's call that fits your research expertise, do not get discouraged. There's so many different programs in Horizon that you may find funding for your research ideas in another program. And for that reason, they're all in red. You have the European Research Council, which is a program for excellent researchers for a single grant to a single research PI, and you set the topic. It must be excellent frontier research. Then we have future and emerging technologies, which also leaves the topics open to which you submit. And then we have the Marie Skłodowska-Curie actions. These are more for individual fellowships. More on all these programs you can find on our website. Under the industrial leadership, there is topics in nanotechnology, nanomedicine, advanced materials, biotechnology, red biotechnology specifically there, and white biotechnology, topics in these areas. Innovation in SME funds research active SMEs in their research fields on the specific criteria. And then under the societal challenge, we have the health, where we go into detail today. But we also have food, any food-related health concerns. You may find topics under this program. Under the climate, there is some few aspects of health as well. And under innovative societies, inclusive societies, you find some more ethical topics that could be of relevance for some of the health community. But that was all to give you an overview on the Horizon programs. Now to the health, societal challenge health. What is meant with the societal challenge health, and what are the goals behind this huge program? The goal is to tackle global and societal challenges and concerns of citizens and the society, and in that respect address political priorities of the European Union. All the proposals ideally have an effect on boosting new jobs, new positions, or on boosting the European growth and investment, and to make Europe as a strong global actor. This is all quite political, and you working in science may not be that concerned about these aspects. But let me tell you, they are quite important when you write a proposal. Because on an example on chronic diseases, I would like to show you why this is relevant when you prepare a proposal. We all know that Europe has a very aging population, and the percentage of the population in Europe above 65 years will increase drastically over the next few years. With this, we will have an increase in chronic diseases, which cause a lot of death, ill health, work preventing, and in that it causes public spending on health that increases and puts the health systems in Europe into difficulties. Due to this, any research you are doing on the elderly, on an aging population, on chronic diseases, you reply to the European priorities and the European political guidelines of reducing health costs in Europe due to the elderly population. So what I'm trying to say with this is any research proposal, any research project can have a link and show the link to political priorities in Europe. And we are here to show you this link and to help you to convincingly write this part of the proposal if you wish us to do so. The participation of the participation of scientists in the health call have some rules. The participation rule is that you need 3 members from 3 different European member states or 3 European associated countries like Switzerland. So for example, a consortium with a French academia, a German hospital, a Swedish SME, and a Swiss university is eligible to submit a proposal. SMEs, small medium enterprises, companies are especially welcome to participate because with their involvement, the aim is to have an effect on the European economy, on job and growth. What is very specific in the health call on the horizon, and it's only for this program, is that US partners can participate and get funding from the European Union. So you can bring, if you have colleagues that you're working with in the US and are relevant for an application, you can bring them into the consortium and they get reimbursed for their work from the European Commission. Why is the Health Work Programme a predefined programme, meaning that the topics that have been launched just a few days ago really are defining exactly for what type of research funding is available in this call? The reason is the European Commission has identified, together with experts, maybe some of you have been involved, have been contacted, have been given advice, and so in that way the European Commission has identified problems, challenges that they want to target, that a wider community has agreed that funding should be allocated to solve such a problem. Once these topics are launched, these problems are open, available, and you can submit, together with your international consortium of experts, the best solution to this predefined, identified problem. What does that mean? That means you can only submit a proposal to a challenge in an open call. It also means that you really have to read the topic descriptions in the open call and see whether your expertise fits into it. The biggest hurdle and most proposals that fail are due to not really fitting into the expectations of the call. For that, again, the national contact points and their networks in all the countries are here to support you, to guide you, and to give you feedback whether your project idea fit into a specific topic. The work program is a large document, a formal document of the European Commission that sets out the research objectives and topics of a specific thematic program. It gives more information. It includes the time frame for submission of proposals, the so-called deadlines. The deadlines for the topics we are going to look at in a minute are in October and November this year and spring next year. It also gives for each topic the indicative budget and sometimes the funding limits. For this call, it's just the indicative budget showing you the size that is expected you need, the budget you need to fulfill the expectations that you really answer the call. The evaluation procedure is also explained in the work program, and the composition of the consortia, if needed, is implied in the topic text because the topic text tells you exactly what expertise is needed to fulfill all the requirements. More than 33 topics are open for more than €1 billion that is available for research projects. Proposals. Just before we look at these topics, on what criteria are these proposals being evaluated? There is 3 different evaluation criteria and you need to reach the threshold in all 3 of them. The excellence is the evaluation criteria that you are all very familiar with. It's how groundbreaking the research is, the level of the ambition, that you go beyond the state of the art, that your approach is novel, but also that you address the challenge, that you address the topic, that you are within the requirements of the work program. The next evaluation criteria where you also have to reach a minimum of 4 out of maximum 5 points that you can reach is the impact. This is the non-scientific impact. This is addressing what the impact for the economy is, for the society is, and to make it easier for you under each topic, the impact is listed in the work program. Factors that are being evaluated there is, for example, the innovation capacity, the integration of new knowledge, the effectiveness of the proposed measures to communicate the project, to disseminate the project results, and, if possible, to exploit the project results. Also, what's being looked at there is how you deal with the intellectual property rights within the consortium, the different partners, and the knowledge that's being created. The third evaluation criteria is quality and efficiency of implementation. If you submit to a two-stage submission procedure, then this is the evaluation criteria that's not being evaluated in the first stage. This evaluation criteria, you need to reach a 3 minimum, that's the threshold of maximum 5 points. What's looked at there is the coherence and effectiveness of the work plan, the competences, experience, and complementarity of the individual participants in the consortium, and how the consortium as a whole reflects all the expertise needed, the partners needed, what you as a consortium, which expertise you bring into it. All these 3 evaluation criteria are essential that you meet them, and that these are being reflected, and when you write the proposal that you really answer them all. Now to the Open Health Calls 2019, and some topics we already know for 2020, but they are not confirmed yet, so we really focus in this webinar on the 2019 call. There is over €1 billion available, and the health work program is split into 3 sub-calls. The first one is better health and care, economic growth, and sustainable health systems. Then there is another call, digital transformation in health and care. And the third one is trusted digital solutions and cybersecurity in health and care. All the topics under these 3 calls can be categorized into different sections. So we have the first one is personalized medicine. That's the development of new therapies, of new medicine, really for the benefit of the patient. There, the main focus is from bench to bed to bring lab data to the benefit of the end user, the patient. I come to the topics in the next slide, but before that I would like to give you an overview of all the areas. On the better health and care, economic growth and sustainable health systems, we also have innovative health and care industry. There, the economic sector, the participation of small medium enterprises or industry is specifically important. Then we have infectious diseases and improving global health. There we have about 6 topics that I'm going to show you. Next area is innovative health and care systems, the integration of care. There I will present 3 topics to you. And decoding the role of the environment for health and well-being. There is 1 topic, and then there will be a 2020 topic that I just quickly go and mention. The next 2 are the digital transformation in health and care and the trusted digital and cybersecurity. So in the next 5 slides, 10 slides, I'm going to show you all the topics that are open in these areas. And you find more information on all these topics on the participant portal. On the personalized medicine, the following 5 topics are open for proposal submission. Understanding causative mechanisms in co- and multimorbidities combining mental and non-mental disorders. System approaches for the discovery of combinatorial therapies for complex disorders. Digital diagnostics developing tools for clinical decisions integrating in vitro and in vivo diagnostics. Towards risk-based screening strategies. And pilot actions to build the foundation of a human cell atlas. The later 2 topics have not been published and are really new. They're just being launched with this call. Towards risk-based screening strategies has a deadline already in October. It's a two-stage submission. What does that mean? That means you submit a short proposal by the 2nd of October 2018. That's 10 pages where you show what you want to do in the proposal. You are expected that this will cost between, or this will need between 4 and 6 million euros from the European Commission to really achieve what is being expected. Then there will be an evaluation, and the proposals with the higher scores will be invited to submit a full proposal. What needs to be said there is that only as many proposals are submitted to the second stage that a success rate of 30% in the second stage can be guaranteed. But now let's look in a little bit more into detail what this topic is about. So the topic title is Towards Risk-Based Screening Strategies, and the text is quite large. You need to consult the entire text on the participant portal if this is in your area. But I'm summarizing it here on the slide for you. You are asked to develop new or refined targeted population-based screening interventions. And for this, you need to identify populations or groups at high risk. And you are wished to stratify your approach by health risk factors determinants. The impact this project is expected to have is to address health inequalities and improve health outcomes, and to provide evidence for healthcare systems implementation. So after all this, if this is in your field and you think, yes, this is of interest to me and potential partners from other countries, then please go and read the entire topic text, see whether a project idea could fit under this, and then contact the national contact point if you wish to just check that you really fit under the topic, and then start planning. You have very little time, 2nd of October, so good luck if that's a topic of interest to you, and we are here to support you. Under the area Innovative Health and Care Industry, there is these 5 topics open. Regenerative medicine from new insight to new applications, new therapies for non-communicable diseases, next generation sequencing for routine diagnosis, new animal-free regulatory test methods for human safety testing, boosting the translation of results of health research into validated, innovative applications. The last topic, you can well imagine that the participation of small, medium enterprises of companies is essential, vital for the success of a submission. I'm going a little bit more into detail for the first topic to show you as an example in this area, the regenerative medicine from new insights to new application. There are several running projects already on regenerative medicine. We have 2 coordinators in this area in Switzerland. And this topic here is again on regenerative medicine. The deadline of the full stage of it's a single stage submission, so that means you submit once, is in April 2019. And the proposals are expected to need between 6 and 8 million euros to reach their goals. The goal here is to develop regenerative processes towards the ultimate clinical goal of addressing an unmet clinical need of public health importance. The processes should be based on innovative approaches such as genome editing or gene therapy, transdifferentiation or in vivo reprogramming, cell therapy and transplantation, 3D bioprinting, to mention just a few that are listed under this topic. So, as I said previously, if this is of interest to you, consult the entire topic text before you start planning. Under infectious diseases and improving global health, there are 5 topics. Mining big data for early detection of infectious disease threats driven by climate change and other factors. Stratified host-directed approaches to improve prevention, treatment, and/or cure of infectious diseases. Implementation research for maternal and child health. Towards the next generation influenza vaccine to protect citizens worldwide. This is an European-India collaboration, meaning you need Indian partners. India helped to define this topic and is interested in these projects and will collaborate. Support for the functioning of the global research collaboration for infectious disease preparedness is the last. As an example of these within the area of infectious diseases and improving global health, I'm going to go into a bit more detail for the influenza vaccine topic, which is very new, which you haven't found on the participant portal previous to the launch of this call. The deadline is April 2019 and it's going to cost, it's expected that the EC contribution will be between 6 and 10 million euro per project. That's per proposal that's being submitted there. What is the idea? What is expected in this call? You're asked to advance next generation influenza vaccine candidates with improved safety, efficacy, immunity duration, and reactivity. You are expected to bring new knowledge of, for example, structural biology, immunology, genetics, and genomics into the project for the vaccine production, formulation, and delivery methods. The project is expected to do preclinical and/or clinical research, to address different population groups, and to select promising vaccine candidates. One short comment on the preclinical and/or early clinical research. If a proposal that you're submitting contains clinical research, you have to submit the template with essential information for clinical studies. That, if it's relevant for you to fill in this template, it is on the participant portal under the specific topic under important documents. So regardless of how you prepare your proposals, you will have to consult the participant portal and see which documents you need to read and you need to fill in. They're all indicated under the specific topic. The next area is innovative health and care systems integration of care. There we have two topics that may or may not be published in 2020. They are not confirmed yet. And then there is the one on the human exposome project. No, sorry, the mental health in the workplace. The deadline is on the 2nd of October. It's a two-stage. So again, you submit 10 pages. Evaluation, if you are successful, you are invited to submit a full proposal in the second stage. The success rate is expected to be 30%. The mental health in the workplace. The idea is to develop and implement interventions that an employer or organization can take to promote good mental health and prevent mental illness in the workplace. If this is an area you're working in, it's essential to read the entire topic text. And what I realized for advising people in the past is that the topic text really puts the focus on the workforce, but it puts also a focus on the elderly workforce and to prevent early retirement. So this group of people needs to be worked with in the project. You need to mirror this requirement. You need to take that requirement into account in order to be successful. The last area in the first call is decoding the role of the environment for health and well-being. There is one topic in 2019, and this is the Human Exposome Project, a toolbox for assessing and addressing the impact of environment on health. The deadline, the first one, will be in April 2019. The budget is substantial. The project proposal is expected to use between 8 and 12 million euros. And you are asked to develop a toolbox of new approaches, technologies, and methods to characterize individual exposure to multiple environmental stressors across the life course. Examples suggested to be used are sensors, cross-omics data, data mining tools, high-performance computing, shared data infrastructure. So now, in a nutshell, I provided you the different topics that are open. I gave you an overview, and the next step would be you get more information on the ones relevant to you. The next two calls are more on the digital transformation in health and care. There I'm presenting topics that Agnes Severini, the Health NCP and Health ICT NCP in Switzerland, can advise you on. The terminology of digital health has many different definitions. It concerns healthcare technology assessment and monitoring. It can also support clinical decisions. It's computational simulations, modeling, and machine learning. It contains e-health, electronic health to enable data transmission, storage, retrieval, and m-health, mobile health, and many other aspects. The digital health goal is to empowering participation of citizens, more digitized, person-centered, community-based care models. It's ICT for active and healthy aging, which is also another program where funding is available. And the policy drivers behind digital health are Connected Digital Single Market and Midterm Review, European Cloud Initiative, European Free Flow of Data Initiative, and Smart Silver Economy. So if you are interested to learn more about the background of these calls, topics in this call, and what were the political drivers for these topics, then please find more information on these via these policy drivers, policy papers, policy initiatives. The topics in 2019 open officially on the 16th of October, and the deadline is on the 24th of April. But please do not wait until next year to start preparing submissions. Use the time, because for every proposal submission, you need a lot of time to set up the proper consortium and to write a strong proposal. The topics that will be launched are big data and artificial intelligence for monitoring health status after cancer, scaling up the univocal identification of medicinal products, large-scale pilots of personalized and outcome-based integration care, support for the large-scale uptake of open service platforms in the active and healthy aging domain. As mentioned, for these topics to get advice on and to get support, please contact my colleague Agnes Severini. As an example, she gave me the slide on the last topic there is no last slide on the topic. Sorry about that. If you need information on any of these topics, please contact Agnes Severini. The last, trusted digital solutions and cybersecurity. Again, Agnes Severini can advise you on this call. And the goal of this call is multidisciplinary technologies and solutions to assure data privacy, security and protection of healthcare infrastructures, secure and user-driven ICT-based solutions, big data approaches, physiological and behavioral data, and the policy drivers behind these objectives are Connected Digital Single Market and Midterm, and its Midterm Review, where you find a lot of useful information, big data and healthcare, and the European Data Protection Regulation. The topic has a deadline. There's only one topic open from the 2018 call, with the deadline on the 14th of November. It's safe, smart, healthy living at home. And to this topic, not to the previous, where I was wrong, Agnes Severini gave me additional information. There is the deadline in November. The EC contribution is expected to be 60 million euros. This is not a typo, 60 million euros. What is expected to be funded is platforms and pilot topics. You can see more information in the Information Communication Technology Work Programme or get them via Agnes Severini. It's not for the development of a single product. The aim is you are expected to work on a mix of advanced ICT technologies ranging from biophotonics to robotics, from artificial intelligence to big data, and from Internet of Things to smart wearables. The pilots should build on open platforms, standardized ontologies, APIs, and results from Internet of Things based smart living environments. The implementation of your project should be in one of the two following areas: either intelligent and personalized digital solutions for healthy and independent living, or in personalized early risk detection and intervention. You have heard all the topics, and to get more information on each, you can see here our detailed topic preview, the service I introduced you at the start of the presentation, where you can get a summary of each topic. What is expected? What is the expected impact? What is the scope that the proposed a successful proposal is supposed to cover? And then in the next step, you consult the participant portal. You find more information on our website, www.euresearch.ch/health. So you have received a lot of information. You may like to know what are the next steps to take. Download the work program and read the full text of the topic you are interested in. Read the impact section, how to address every aspect. The impact section will also tell you what expertise you may still missing in the consortium that you may have to bring on board. Go directly to the participant portal, filter to health, and select the right call and right topic. Via this approach, you will get all the documents that you need to fill in, the proposal template, and all the other information. If you need help, please do not waste any time. That's what we are here for. Contact us at health@euresearch.ch if you wish to know more or get an idea check, meaning to see whether you're in scope of an open topic, or get in touch with the Euresearch office in your region. We are here to help you. We are here to help you save time and get through the jungle of Horizon documents. This is the participant portal. If you found a topic, you type it into the participant portal. You can see here, it gives you the deadline, it gives you the budget expectations, and on the topic description, you enlarge the window and you see all requirements. The topic conditions and documents, there you find everything you need to submit. What I also would like to add at this stage, and I will go into more detail later, is that under each topic you find scientists, experts, companies all over Europe looking for partners under the specific topic. You can also put the profile there and you can see who else is looking for collaboration, and you are more than welcome to contact them. The next steps you can take is preparation is key. Start joining a consortium as fast as you can. If you need advice, support in this step, do not hesitate to contact us. The health applicant training by Euresearch will be taking place in Bern on the 23rd of August this year. It's a national annual event for anyone preparing a proposal. You can register via this link, www.euresearch.ch/health 2018. This one-day workshop is free of cost, and the idea is to give you an overview of what you need to know, go into detail how you should, what factors you need to consider writing a strong proposal. You get advice on filling in the forms, on legal financial criteria, on ethical criteria, clinical criteria. We try to give you as much information in that day that you need for writing and submitting a successful proposal. The afternoon session of this training has a panel discussion, and I'm very happy to say that we have 3 excellent speakers for the panel discussion. We have someone from the coordination team of music and someone from the coordination team from the biochip projects, 2 running projects with clinical studies that are both being coordinated in Switzerland, one in Basel, one in Zurich. And these 2 ladies will take the time to talk about their experience preparing the proposal, running the project, and giving you advice and answering any of your questions you may have that you need an answer to in order to write a successful, strong project. We will also have the evaluator Dr. Med Conrad von Bremen, the director of the Swan Isotope Center, who evaluates proposals every year for the European Commission. So you will have different aspects and you will have a lot of expertise in that training that you can ask questions to. Check other upcoming events on our website. And if you haven't done so yet, I advise you to subscribe to our e-alerts that you get information on time to upcoming calls or events. One quick word before we are coming to an end, how to best build a consortium. There is different databases that can assist you in finding partners. There's the so-called embedded participant partner search, where you can find partners that we just looked at under the topic that I showed you in a minute ago. Then there's the Cordis project database, where you can find all the names of people that are in running or past projects. Very often, excellent scientists or companies that have made good experience in running projects will submit a proposal again. So you can actually find potential coordinators in this project database. Then I would like to warmly suggest that you look at the Enterprise Europe network, which is a network where you can find a lot of companies with a lot of different excellent expertise. Then the partnering events by the Health NCP project. There, the next event will take place in Oslo in September. We have sent out an e-alert, and if you wish more information, please go onto this Health NCP website. Then there is the partnering and info events by the Idealist, the ICT. This is more for the digital health. I will show you a slide on the next ICT Digital Health event. And then ECRA, for the ones of you that submit proposals with including clinical studies, ECRA may be a partner that you would like to consider. Or you're taking a CRO on board. This is the embedded partner search that we talked about in the previous few slides, and this is the project database to identify key actors already active in EU projects. The example here is OPRAM. This is a health project that is running with a coordinator from Bern. You find all the partners and you find a summary of what they are doing. That is one way of finding experienced coordinators that you may want to contact if you look for participation in a consortium as a partner. Now, the ICT Digital Health next big event is in December in Vienna on ICT 2018. E-health is there a big topic, and you can find your consortium at this event or find missing expertise, missing partners. This was all I wanted to present you on this launched health calls. To end this presentation, I have some key messages, take-home messages that may be useful to keep in the back of your mind when you prepare a proposal. Read the full topic text. Ensure your proposed work meets the topic addressed by the call. Follow exactly the structure given in the proposal template that you can download under the specific topic. Be concise and precise when writing the proposal. The consortium partners must be excellent and appropriate for the tasks, meaning really required for the project. Do not overcrowd objectives and show how you achieve them. Ensure qualitative and quantitative deliverables and benefit from the offered events that Euresearch offers you. Also benefit from all our services if you wish to do so, from project idea check to proposal review to any questions you may have. We are here to support you, to guide you, and to make your application process easier. We do not write proposals, but we can give you feedback by reading them. Thank you very much for your attention. I hope this webinar has been useful. The contact details are here, and we look forward to hearing you, and we wish you a lot of success in your future submissions.